Why insist on university? The thousands of dedicated professionals and volunteers who work at university choose us because of any number of reasons. It could be because university is the only magnet hospital in the region, a testament to the quality care our nurses provide and a distinction shared with only 5 other Georgia hospitals. University stays at the forefront of technological advances, finding new ways to treat our patients that get them home faster and with better results. Or it could be because university fosters within its employees a sense of family and responsibility to our community. But our patients and the community we serve insist on University Hospital for more personal reasons. Breast cancer is a terrifying prospect for any woman. So Jackie Lawrence was understandably nervous when she was called to her physician's office after a routine mammogram in 2005.
When I first was diagnosed, the nurse came to me first, before Pam, and she sat down and talked with me. At that time, I was really frightened, and I got very emotional. And so right away, she called in Pam. And it started from there, and it just eased my pain, you know, and my fear.
Pam is Pam Anderson of University's Breast Health Center. Pam was just one part of a team of physicians and clinicians working behind the scenes to develop the best cancer treatment plan for Jackie through University's Cancer Conference, the only program of its kind in the CSRA.
Being a cancer patient, I was really afraid, but they gave me hope. They made me comfortable, and University really treated me well.
6 years after her diagnosis, Jackie tirelessly gives back to University and the Breast Health Center as a member of the Pink Magnolias Breast Cancer Support Group, as well as volunteering for a number of community cancer support programs.
There's one thing I'd like to leave with you, and with all of the cancer patients: don't pity yourself. Live life to the fullest. You're going to beat it. With University's care, you will make it.
While still in medical school, Dr. Robert Campbell cultivated an idea to address the healthcare needs of the poor. His mission eventually evolved into one of the most successful sources of health care for Augusta's underserved populations, Christ Community Health Services. But getting a project of this magnitude off the ground was no easy task. So Dr. Campbell turned to University Hospital.
Through the years, University Hospital hasn't just provided financial support. They provided inpatient care for our patients. They provided labs and other diagnostic services. Let me give you a very specific example. I know, for instance, that over 50% of the women that I take care of have been appropriately screened for breast cancer through the mammography program. This is a real blessing to our patients. Not only do they make it affordable, but they make it convenient by bringing the mammography van to our clinic.
Christ Community Health Services has continued to expand since it opened in 2007. They've grown so much, a second location was launched in August 2011 at the Ann Boardman Widows Home on Telfair Street.
I think from day one, University Hospital was attracted to our mission at Christ Community because of our mission and because of the quality of care that we strive to achieve. I think those things are things that University has done since its inception in 1818. High quality care, commitment to community. And those are two things that I believe are just a natural fit with University Hospital and Christ Community Health Services.
University's continued support of Christ Community Health Services is just one way we make a difference within our community, today and into the future.
University Hospital has allowed all of us at Christ Community to fulfill our dreams. We wouldn't be able to do what we do without the support of University Hospital.
Judge Doug Flanagan is not one to just sit around. So when the normally active Boy Scout troop volunteer started noticing fatigue and breathlessness after his routine hikes, he knew he needed to do something fast.
I talked to my daughter, who's a PA at University Hospital, and she told me I needed to get the best health care I could, and she said this is the place to come at the Heart Center.
One stress test later, Judge Flanagan was immediately admitted to University's Heart and Vascular Institute and scheduled for quadruple bypass surgery. Judge Flanagan came through the operation with flying colors.
I think people should insist on University because it has full services. You know, it's not just a question of seeing the physicians for cardiac problems. They have the physical therapy, they have the PT. It's right in the same building. You go down to the bottom floor, they got the gym, they got the walking track. You go upstairs, they have the cardiologists, they have the surgeons. It's all in the same building.
Through University Cardiac Rehabilitation Services, Judge Flanagan regained his strength and confidence. And it wasn't too long before he was back doing what he loves, spending time in the great outdoors with the Boy Scouts.
The bottom line is I'm here, I'm having fun. I know the Boy Scouts appreciate me being in better health, being able to do more things, straighten out some more youth. I know the people I work with appreciate I'm back around, and I owe most of that to University Hospital and my wife.
A baby is a joy. Twins are a delight. Triplets, especially triplets that occur naturally, are, well, they're a surprise.
We looked at each other and said, babies. She said, yeah, y'all are having triplets. And I told her that I wasn't trying to be rude, but I'd like to have a second opinion.
Seth and Brandy Howard quickly came to terms with the sudden population explosion in their family, and the pregnancy was progressing normally until Brandy developed pregnancy-induced high blood pressure. The situation grew critical, leading physicians to deliver the 3 babies at just a little over 30 gestational weeks, which sent the babies directly to University's Level 3 Special Care Nursery.
We told them from the get-go that our children were in their hands. If you recommend it, then that's what we need to do.
McKay and Wells, who are identical, and Cyrus, who is fraternal, spent more than a month at University Hospital, the last baby making it home on Christmas Eve. The care the triplets received at University meant so much to the young parents that on the boys' first birthday, they made an unusual request.
With the financial position that we were in from their delivery, we couldn't give back, a generous donation, and so we felt that with the boys turning 1, that it was just the right event to share with the hospital, and so we just asked that friends, in lieu of gifts, make donations to the Special Care Nursery in their honor.
The Howard triplets are now officially toddlers, making life more interesting for Brandy and Seth.
They are rambunctious little boys. They are climbing and crawling on everything and just full of life, and it's just so exciting to see their individual personalities coming out.
The young parents are ready to take on the next exciting and rewarding chapter of their lives, and they're thankful that University was there when they needed it most.
We insisted on University just because the nurses and the staff here just make you feel like family. I mean, they just calm your fears and just make you feel like you have no worries when you leave your children here in their hands.
Teamwork, community, expertise, compassion. These are just a few of the trademarks University strives to achieve each and every day for each and every patient. For nearly 200 years, University has been dedicated to the health of our community, and we look forward to doing exactly that for years to come.